Labour is putting the progress they made at risk. Russia has confirmed Vladimir Putin won't attend the first direct talks between Ukraine and Russia in more than 3 years. Volodymyr Zelensky had challenged the Russian president to meet him face-to-face. US President Donald Trump also won't be in Turkey for the negotiations. An interim report suggests a super yacht belonging to tech tycoon Mike Lynch was knocked over by extreme wind. Simon Graves from the Marine Accident Investigation Branch says the ship wasn't set up for the conditions.
The information that the crew and the owner had to assess their safety in this condition didn't account for the level of wind that they were faced with. So the guidance they were working to didn't hold the information relevant to the circumstances of the accident.
7 people died when the Bayesian tipped over in just 15 seconds before sinking near to Sicily last August. The billionaire and his daughter Hannah were among them. Ministers are facing a backlash from victims' groups over planned changes to the prison recall system in England and Wales. Offenders serving between 1 and 4 years, who are recalled to jail for breaching their licences will be released after 28 days. And the latest audience figures show LBC is still the UK's leading commercial radio news talk brand. 3.3 million of you are tuning in every week, and 1.4 million people are choosing Nick Ferrari at breakfast to start their day. So thank you. In the city, a short time ago, the FTSE 100 was trading down 46 points at 85.38. The pound buys $1.32 and €1.18. LBC weather staying dry and sunny. Sunshine will be hazy at times with some low cloud in eastern England. Cooler in the south with a high of 23 degrees. From Global's newsroom for LBC, I'm Amelia Cox.
Hi.
This is LBC from Global, leading Britain's conversation with Nick Ferrari at breakfast. Call and WhatsApp message now 0345 6060 973. Text 84850. Nick Ferrari at breakfast on LBC.
Good morning. 3 minutes after 9 on Thursday, May the 15th. And when I think of all the years I've had the privilege of discussing so many stories and events and issues with you, probably none is as sensitive as the one we're going to explore here now, which is the idea of assisted dying. And I'm reminded of the debate in the House of Commons, which I think is fair, and all parties, I think, would agree it was probably Parliament at its finest, in that these people, most of whom are simply there to try and make the country a better place and sometimes endure the slings and arrows of outrageous misfortune in the process, they did debate it in a healthy fashion with great respect and regard. So this is your opportunity to engage directly with the Labour MP who has worked tirelessly in this area, who is obviously a supporter of the idea of assisted dying legislation. I speak of Labour MP Kim Leadbeater, who joins me now. It's easy if I call you Kim throughout that, but it's a little bit personal, so can I call you Kim through the course of this conversation? Good morning.
I am very happy with Kim. Thank you. Good morning.
It doesn't have to be the Honourable Member for Spen Valley.
Does it eck?
Does it eck? Kim, I've got to read to you a couple of comment pieces or editorials from 2 newspapers today before I come to the calls. For the Daily Mail, it's a shameful stitch-up over assisted dying. For the Times newspaper, in their leader, warnings about the assisted dying bill grow louder by the day. MPs must now vote down these ramshackle and dangerous proposals. Kim.
Yeah, I mean, that's very disappointing, to be honest. I think you're absolutely right in your opening remarks about what a fantastic job Parliament did last November at the second reading of the bill. And I think we've seen largely civilised and respectful debate and discussion on this issue. But I have to say some of the media coverage has been quite polarising, which I don't think is particularly helpful, and also sometimes quite misleading as well. What I'm trying to do over the next few weeks as we go through the next stages of Parliament is keep that debate civilised and respectful, and also based in facts and the actual content of the bill. And I would say to anybody, please read the bill. if you've got concerns, if you've got whatever opinion is, have a look at the bill, have a look at the detail of the bill. That's what matters. But I also understand what an emotive issue this is for people. And if you are opposed to a change in the law, and I respect that some people are, there is a lot of passion about this subject.
Well, the first call is
but I
going
would ask
to be
journalists to be responsible.
OK, I hear you, Kim, and hopefully I shall be for the next 25 minutes or so we're together. The first caller is going to be from a doctor in Cardiff. Just before that, obviously we have the development that the RCP, the Royal College of Psychiatrists, has pulled its support for the bill. How devastating is that, Kim?
Well, it's not particularly devastating because it's not accurate. They never supported the bill. The Royal College of Psychiatrists has a neutral position on assisted dying, and I've engaged with them. I've had a couple of meetings with them, and I think it's misleading to say that they've withdrawn support because they're neutral on it. And actually, the last survey they did of their membership said that 45% of their members supported a change in the law, and 45% opposed it, which is the same for many professions. We know that there's a different range of opinions. So it's slightly misleading to say that they've withdrawn their support.
Kim, but Dr. Lade Smith, president of the Royal College, said the organisation is neutral but found, quotes, a number of issues, close quotes, including the possibility a terminally ill patient could be, quotes, a very treatable mental disorder. Don't you need a psychiatrist sitting on the panel? This three-person.
We do have a psychiatrist sitting on the panel.
If the Royal College of Psychiatrists say that they have concerns, are you going to get a psychiatrist on the panel?
Yeah, again, as I say, half their membership are in support of a change in the law and half are not. So I think it wouldn't be an issue to get psychiatrists to engage in this. Clearly not all psychiatrists. And it's very important that any profession who doesn't want to be involved in the assisted dying process has the option to opt out. And indeed, I've got an amendment which I'll be speaking about tomorrow in Parliament, which broadens that opt-out provision. But psychiatrists were very keen that they should be involved in the process because of their expertise. Therefore, I've included them in the process. So I've been listening to different organisations and professions along the journey of the bill, and I think it's important that they do have a role. But remember, anybody with a mental health condition is excluded from eligibility within the bill. We're talking about people who have a 6-month terminal diagnosis only. And if there's any doubts about mental capacity, either one of the doctors involved in the process now has to make a compulsory referral to a psychiatrist. That was an amendment tabled by Daisy Cooper, a Liberal Democrat MP, which I was very pleased to support. Okay. So again, if you look at the process, there are very strict safeguards around mental health conditions and around having that professional expertise and input.
Kim, that's enough from me. You're here to take listeners' calls. Leshmi is in Cardiff. Leshmi, go ahead. You're through to Kim Leadbeater.
Hi there. As a GP, we're heavily involved in palliative care, and inevitably this work is going to fall on us as well. So my question to you is, would you be happy to stand by a patient's bedside, administer a lethal injection and watch the life drain out of that patient? Because that's what you're asking me as a physician to do, and how that would affect me. Would you be happy to do it?
Hi, Leshmi. I'm not asking you to do it. I'm asking any GPs that are comfortable doing it to be involved in the process. As I've just said, the opt-out clause within the bill is very, very clear. If this is something that you wouldn't be comfortable doing as part of your work, there's absolutely no obligation for you to do it whatsoever. And also, the doctor would not administer the substance. The bill is very clear. This will be the patient. It is self-administered. So whilst
to
Leshmi's
point, the doctor or the nurse has to load it up, doesn't it? Load whatever the drugs may have to be out, Kim. That's fair, isn't it?
Yeah, that would be the level of assistance. But again, only if they were comfortable doing it. And I've spoken to lots of GPs who are very much in favour of a change in the law. I have a colleague, Simon Offer, who's a GP. Now he's an MP as well. And he's very clear on his professional and medical experience that the law does need to change. Okay. So there's a range of views. But to Leshmi's point, absolutely, if you didn't want to be involved in this, of course you wouldn't have to
I'll come back to you, Leshmi, in a moment. But to her question, Kim, would you do it?
Well, I wouldn't be trained to do it, so no.
But if you were, but you know the point she's driving at. If you were a doctor, would you be prepared to do it?
Well, I mean, I would be prepared to be involved in a compassionate end to someone's life if that was of their choosing.
Okay, so
and it's always about choice. I mean, I have friends and family who are very clear that they would want this option for themselves. Okay. There is overwhelming public support for a change in the law. And literally everywhere I go, people will stop me and say, thank you for putting this forward. I would want this choice.
Leshmi, a quick follow-up if you want it. Leshmi?
Yes. So considering that in the Royal College of GPs, only about 45% support this, are you really going to have the manpower for just half of the GPs to be able to do it, considering we don't already have enough GPs and physicians? How are you going to manage that then if the patients want it?
Kim?
Yeah, so I mean, in other jurisdictions with a very similar assisted dying model, it's less than 1% of deaths take place through this process. And also the other point I would make is that these are not new patients. These are terminally ill patients who are already seeing doctors and having treatment. So there's not going to be a huge influx of new people because they're already dying and in the last few months of their lives.
All right. Thank you, Leshmi, and thanks for the work you do as a GP. Carol is in Hemel Hempstead. Carol, you're on the radio. Good morning.
Good morning. Good morning, Kim. I was anorexic all the way through my 20s because I was very depressed, and I really didn't want to be here. Life wasn't worth living, and I'm pretty sure that if the assisted dying option was available back then, I almost certainly would have taken it. But then in my early 30s, I found faith, and all my mental health issues were dealt with and healed.
Good.
And went on to have a successful career. So I'm proof that people can recover from anorexia. It might not be the case for everyone, but it can be. And if I had had the option back then, I wouldn't be here now. So I'd heard that it was going to be offered to anorexics. Is that the case?
No, that's definitely not the case, Carol, and thank you for sharing your very personal story. In my previous career, I worked with people with eating disorders, including people with anorexia, and I know what a dreadfully traumatic and painful condition, an illness it is. Mental health conditions are excluded from eligibility within the bill. You also have to have various assessments of capacity within the process. So I'm confident that people with anorexia would not be included within the bill. That's not classed as a terminal illness.
But proposals were voted down last month, in February, that would have prevented people with the condition from being able to access assisted dying, quotes, as a result of stopping eating or drinking, rejected by MPs in February.
Yeah, and there's another amendment which has been tabled to the next stage of proceedings, and I am looking at that in great detail because I know how much this means to
So there is a reality. There's a loophole that has to be addressed here, Kim. Is that fair?
No, I mean, I don't think this is a loophole. If you look at the definition of what a terminal illness is, it's an inevitably progressive illness or disease which cannot be reversed by treatment. Now, anorexia can be reversed by treatment, and I would hope that if an anorexic patient was presented before a doctor, they would refer that patient for the help that they need, both the psychological support that they need and indeed the physical support that they need to start eating again. And there's support networks around how we can do that for anorexic patients. And again, the capacity assessment. If somebody's so poorly with an eating disorder, and again, I have worked with people in this situation, the chances of a psychiatrist saying they have got capacity to make that decision are extremely limited, and they would have to be in the final few months of their life. But again, I am conscious of how important this issue is to people, and I am looking at work around that.
OK, Carol, congratulations again on getting better. I know that's a crass
word,
well
but
done,
really Carol.
The best of luck to you, and may you be in good health for many, many years to come. Thanks, Carol. Trevor's in Dulwich. Trevor, you're through to Kim. Go ahead. Good morning.
Oh, good morning, Kim. Yeah, I just wondered if you thought that MPs who are opposed to the law are really paying enough attention to how appalling our current laws are. I mean, forcing people abroad to Dignitas, which I'm sure people have heard of, but as a celebrant, I came across many families where someone had taken their own lives who were terminally ill because that was the only option they had, and the tragic aftermath of that, whether really that's being lost sight of in all of this.
Trevor, thank you. You absolutely hit the nail on the head. And I think as parliamentarians, we've got a duty to fix problems. And I think when I look at the status quo, there are a lot of problems in this area in terms of, the choices that terminally ill people have. We've got the inequity, as you quite rightly say, of people having the option of going to Switzerland to Dignitas if they've got a considerable amount of money to do that, £15,000. Sometimes that's also painted as the nice option. It's not. It's deeply traumatic and harrowing for the person and for their loved ones. They then return back to the UK, and I've had people email me about this. They have a knock on the door from the police. They are there under a police investigation, and we know they're generally not prosecuted, but that hangs over them on top of their bereavement and their grief. We also know that around 600 terminally ill people every year take their own lives out of desperation, often again found by their loved ones. The trauma of that you can only imagine. And we also know that there are people with particularly some of the most horrible forms of cancer who face very difficult, painful, harrowing deaths at the end of their lives. So if we look at things as they are now, we have to acknowledge there are problems that need to be fixed. And of course that has to be done in a responsible way with safeguards and protections for people, but we cannot allow that to continue, in my view. And that's why we've got 4 former directors of public prosecution who support a change in the law, because those cases of prosecutions came across their desks. And I just think we've got a duty as parliamentarians to solve that. So it's partly about human suffering and dignity and bodily autonomy, which I firmly believe in, but also about looking at the status quo and saying, this can't be acceptable.
OK, Trevor, thank you. We're going to Jay now, who's in Spain for work, but he lives in Finchley in North London. Jay, your question. Good morning.
Good morning, Nick, and Kim, if I can call you Kim, that'd be marvellous.
Of course you can,
just briefly, I lost my son a year and a half ago at the age of 30. He had 7 life-threatening conditions, the last one being pulmonary edema. The hospital decided that they were going to go ahead and write a report that basically he had limited time to live, and they took it upon themselves to take his life. In the process of going through his notes, I've noticed they were going to remove me and my wife from being his responsible advocates because we would not sign a DNR and we were against them taking his life away in the way they did. Mm-hmm. Now, I'm not against what you're doing at all. I really am not. But my question is, first of all, do you regret the judge being removed from the process? Because I think that's quite an important one. And the other question that I have is, how do you validate the information given to the panel to ensure it's a true and correct representation of the truth?
Jay, a couple of very good questions. I want to start with offering, obviously, my commiserations, and I'm sure Kim does too, for the ordeal you and your wife have been through. That's horrific, and I give you my condolences. Kim, a lot of supporters...
Absolutely.
Sorry, Kim. Yeah, a lot of supporters, when the High Court judge element was removed, they had questions over that. Do you now regret that?
Yeah, Jay, I agree with Nick's comments. I'm so sorry for your loss. That sounds like an extremely traumatic situation to be in. Look, I was always really clear that if we were going to have the most robust piece of legislation in the world, which this absolutely is, a third layer of scrutiny and safeguarding was really, really important. So we have the 2 doctors who provide the medical expertise, but for me that third layer was important. But what the evidence showed in Bill Committee very clearly was the need for a multidisciplinary approach to this process. So that's why still having legal expertise and oversight by the Voluntary Assisted Dying Commissioner, who will be either a judge or a retired judge, but then a panel of experts. So we still have a legal expert in there, could be a very high-level KC barrister or indeed a judge, and then a psychiatrist and a social worker. It shows a much more holistic approach to address 2 of the key issues that have come up throughout the debate. One around the patient having capacity to make this really huge decision, and secondly around coercion and pressure that patients may feel. So by adding the social worker and the psychiatrist, keeping the legal oversight, that is a much more robust approach.
Are you saying it's stronger, Kim? You believe the removal stronger. Of the High... You're telling me you think it's stronger without the High Court judge, Kim?
Absolutely. And colleagues in Parliament have approached me on many occasions to agree with that, including lawyers, and who have said, look, we never really felt that the judge was the right person to do this. And I think that's a fair comment. No disrespect to judges, because I think they would have done a perfectly acceptable job. But having a more holistic approach, a more patient-centred approach, I think is much, much stronger.
All right. Let's come to some of the questions coming in. Thank you, Jay, and again, condolences from the both of us, I'm sure. Come to the questions that are coming in via email and some texts as well. Rachel in Bexley, how much is this going to cost the NHS? Kim?
Well, there was an impact assessment done, Rachel, by the government, I think last week or the week before. What I'm trying not to do, because I don't think it's the right way to approach this issue, is boil it down to pounds and pence. There will be cost in terms of setting up the initial infrastructure and the initial systems, the Voluntary Assisted Dying Commission and the panels as such, but then there will also be savings as well as a result of the process of the bill. But I think
savings as in long-term care for dying patients. Is that what we're saying?
Yes.
Yeah. Okay.
Yeah. Okay. So there will be savings.
I have
a
figure
NHS
here of between 10.9 million and 13.6 million pounds per year. Is that a figure that you recognise?
Yeah, I think that's taken from the impact assessment, Nick. Yeah. So it will save a considerable amount of money, but I think that to me feels not quite the right conversation. I understand the government have had to do that work, and they've produced a very, very thorough 150-page document which goes through all the detail. But for me, this is keeping it about the human cost rather than the financial cost. But again, if people want to think about, is this going to save money? The reality is it will save money, but that absolutely is not the reason to do it.
OK, Jose in Dartford, have you done an estimate of how many doctors or nurses will want to opt out of giving this treatment? What will the impact be on NHS staff? We touched a little bit on that actually in that first call, but have you got an idea of what number of people might say, listen, I'm sorry, I don't want to get involved? Kim?
Well, again, going back to the previous comments, the polling within the British Medical Association is about 50-50. So there are doctors who would want to be involved in this and doctors who wouldn't want to be involved in this. And that's basically, I think, absolutely how it should be. I had a couple of very good meetings with the British Medical Association. They've just done another briefing for parliamentarians, which is very, very helpful, talking about the need for the doctor to be able to discuss all options with the patient and that patient-centred approach. But and I'm very clear there will be some medical professionals who would not want to be involved, and I'm very respectful of that, and they should be given that opt-out, which the bill does very clearly. And there are others who, because of the work that they've done around end-of-life care, are very clear that the law does need to change and would want to be involved.
Okay. Earlier in the show, I was speaking with Dr. Rachel Clark, someone who you might know. She wrote a book about the pressures of working on wards in COVID, and she has been putting social media posts out about this. I was talking about the issues in A&E, but she did ask for the opportunity as a palliative care doctor to leave a question. So this is Dr. Rachel Clark's question to you.
I am pro assisted dying in principle, but strongly opposed to her bill because I do not think it is safe at all. The safeguards are not there. So my question to Kim is, why are you telling MPs and journalists and the public that this bill is the safest in the world when the simple safeguards that palliative care doctors, psychiatrists, social workers are all begging you to include, you have refused, you have rejected those amendments. We know why you've done that. You've done it because the government has told you the money's not there. The palliative care doctors aren't there. The psychiatrists aren't there to make sure this bill is as safe as it could be. That's not good enough because that is prioritising saving money above making this bill as safe as it should be.
And the doctor went on to say there needed to be more face-to-face consultations with people who might seek to take this route. Kim Leadbeater.
Gosh, I'm quite surprised by Rachel's comments actually there. Rachel is an amazing professional who has worked in palliative care for a long time, but what she said there is just not true. This is nothing about saving money. And I think we just probably disagree on the issue around the safeguards within the bill.
What is driving it then, Kim?
Oh, it's about the choice for terminally ill people and for dying people. That's exactly what this bill is about. I've already talked about the situation as it exists, and literally, every day someone will come up to me with a traumatic story of losing a loved one under harrowing and difficult and traumatic circumstances, or finding a loved one who's taken their own lives, or just the people that want the choice and they want the dignity and the control over their body in their dying days. That's absolutely the driving force behind this. So to suggest that this is about anything other than helping terminally ill people to take control and have choice and alleviating their suffering, but also addressing the failings in the current situation is just not true. Right. And in terms of the layers of safeguards throughout the bill, I absolutely stand by the fact that this is an extremely robust piece of legislation. I've spent hours and hours and hours in meetings with government officials, with parliamentary official council who draft legislation. It is an extremely robust piece of legislation.
All right. Next caller is Jurgen, who's in Utrecht in the Netherlands. This could be an interesting perspective on this. Jurgen, you're through to our MP. Good morning.
Good morning, Nick. Good morning. Thank you for having me. Nick, I'm from the Netherlands. We've obviously had assisted dying here for some time. And they've got robust plans in place. They seem slightly less complicated than what Kim is trying to portray. Looking at the NHS in the current state where we need to get authorization from a barrister and a psychiatrist and different doctors. My uncle is being buried tomorrow. He had assisted dying last week Tuesday.
Okay.
Decision was made on the Thursday prior. His doctor approved of it.
Okay. And my condolences to you, sir. I'm sorry to be rude, but can I move you to the question, if you mind awfully, Jurgen? What is the question you'd like to put to the British MP?
I think that her robust plan seems to be very long-winded, where a terminal ill patient, for starters, I don't think he's capable of administering a drug themselves. That's what you got NHS professionals for, that decide to be part of this if they wish to do so.
Okay. So do you mind my asking, sir, lastly, from your uncle taking the decision that he wanted to end his life, how long was the process and how was the drug administered, lastly, Jürgen?
The decision was made by him and his wife on a Thursday. They discussed it with the doctor in a hospice on that same day.
Yes.
The decision by the doctor was done the following Tuesday.
Good Lord. And the doctor did it himself. Wow. Jürgen, condolences. I appreciate it's a very dark day for you tomorrow. I hope you can get closure from losing your uncle, and I'm very grateful for your input from a country where it has been in practice. Kim Leadbeater, decision taken and done within days. Your reaction to that?
Yeah, gosh, thank you, Jürgen. I think what you've made is a really important point. Well, two important points, actually, Jürgen. One, we are behind the rest of the world in terms of giving people this choice. But the other criticism that I've faced from certain quarters is that the process that I've put in place is indeed too strict. Now, I have to be honest, I feel the situation you've just described isn't something I would be able to support. That feels like a very quick process, and I would have some concerns about that. But you're absolutely right. Assisted dying has operated in lots of jurisdictions around the world with different models, safely, effectively and compassionately. I've based my bill around Australian states and some American states where the process is much more robust with a much stricter eligibility criteria, literally just people in the 6 last months of their life. But I appreciate for some people there, and I've had contact from people, dying people who have said, goodness me, Kim, you're making us go before 2 doctors, a psychiatrist, a social worker, a lawyer. We're dying and we just want to take control and have that choice. So I appreciate that criticism, as well as the criticism from the other side that are saying this is not safeguarded enough. It's a very difficult balance to strike. But I think the bill does that. It does it in a safe, effective and compassionate way. But the fact that we have got other countries with assisted dying laws giving people in their final days choice shows that we are behind many other nations, and indeed we're behind the public mood. I mean, polling in this country is consistently around 70% of public support for a change in the law.
Yes.
So Jürgen, thank you, and I hope tomorrow at the funeral is as okay as it can be.
Well said, yes. I hope it brings you some sense of closure, Jürgen. Thank you. Let's get another call. David in Elmbridge. David, you're through to Kim. Go ahead. Morning.
Morning, Nick. Morning, Kim. It's lovely to be on the air. I'm a big fan of assisted dying and the right for people to have some choice over the timing and manner of their death. Very interesting to hear Jürgen's perspective from Holland, which I would support. At the same time, I do understand the concerns that people have about coercion and the malicious influence of friends on vulnerable and risk people. However, for me, the solution seems to be quite straightforward in my view, is that would be using the word deterrence. Because if the consequences and the sentencing of somebody who was found guilty of putting pressure and undue influence on someone to take their own lives, if that was made sufficiently punitive, akin to aiding and abetting a murder, then you would significantly disincentivise that person from being coercive and therefore be providing the protection to those who are potentially the vulnerable that other people seem to be very keen to protect.
What an interesting way of coming at it. If it was proven that I, unfortunately they're no longer with me, but if I basically bullied my mother into going to assisted dying, what might be coming my way in the shape of the law?
Well, the good news is, was it David? Sorry, the
David
good news
is the caller,
David.
Kim.
This bill creates criminal offences exactly to that effect, and those offences do not exist at the moment because, you know, going back to the status quo, we have people taking their own lives at the moment, and we have got no idea if they've been coerced or pressured by anybody to do that. Even the people who do make that journey to Switzerland, is there someone saying to them, do you know what, the time might be right, maybe you should do... We've got no idea. And this is the point that legal people make. There is no safeguarding and no protections around that. Within this bill, we have multiple levels of safeguards and checks for coercion and pressure, and we also have criminal offences that mean you could go to prison for life if you
that
are
was the
found
point,
guilty
David.
of that.
So the ultimate sanction,
Exactly.
if someone is found to have effective bullied grandma to an early grave, you could look at a life stretch.
Yes.
Okay, all right.
Yeah, under this bill. And that is, again, why the law needs to change. So we talk a lot about the moral and the ethical issues, but the legal point is the law needs to change.
All right, I'm going to finish with a couple of emails and text questions because they're quicker to get through. David, thank you for your call. Pam in Worcester Park, is it true that this won't be implemented by 2029? Have you already written off this Parliament?
No, I mean, the bill as it was first drafted had a 2-year commencement period, which I was very pleased with. But there is a big piece of work to be done. And I've always been really clear that it's more important to get this right than to do it quickly. So there is now a 4-year backstop, and it is very much a backstop. I think it can be done sooner. I will certainly be putting pressure on the government to do it sooner. And I've put amendments to the bill, which would mean they have to report to Parliament after a year.
I'm sorry to use this expression, it's not going to be in the lifetime of this Parliament, is it? Come on, Kim.
Well, I will do everything I can to make sure it is, and I know other colleagues will do the same as well. I think it would be very wrong that we wait until this Parliament is finished, if Parliament indeed chooses to pass the law.
One headline says the bill may fall. More MPs are changing their mind, reports the Daily Telegraph, Kim.
Well, I mean, I'm certainly not getting that impression from the conversations I'm having with parliamentary colleagues. There might be some move in either direction, but certainly not a huge amount of movement. But implementation is important, and I am conscious that, when that backstop was extended, some people were very disappointed, and I was one of them. But I do think we've got to focus on getting it right, putting the infrastructure in place, and then hopefully we can give terminally ill people the choice.
Graham and Bushy, both my children are doctors. They say they can't see any private doctor signing off on a patient to assist their dying for fear of being sued. What safeguards will there be to protect NHS doctors from potentially being sued by families of patients?
Well, again, that is all about the safeguards and protections within the bill, not just for patients, but also for medical practitioners as well.
So there will be some kind of exemption in place?
In terms of
the doctor. So imagine if angry relatives then decide that their grandmother or whatever had been unfairly treated, would the doctor then possibly could he or she suddenly face legal proceedings? That's, I think, Graham's concern.
No, I mean, I've put a new schedule in the bill, which we'll discuss, I think, tomorrow, around employment protections. So doctors are covered in terms of their involvement in the process. But equally, if doctors do anything untoward that isn't within the scope of the bill, of course, they will be subject to penalties. But essentially, the doctors, A, have got the choice whether they're involved or not, and B, have got employment protections as long as they fall within the legal framework of the bill.
Final question is nothing to do with the work you're doing here, but rather your party leader, Sir Keir Starmer. There's an ongoing investigation, but you'll be aware there have been reports of allegations of arson attacks on his home and indeed a car he once owned. Noting, of course, that you were the sister of Jo Cox, who lost her life in 2016. How concerned are you about the safety of MPs, the increasing toxicity for the work you and your colleagues do? Kim?
I mean, I've been talking about this for the last nearly 9 years now since Jo was murdered, and sadly we've seen the murder of another MP, Sir David Amess, in that time as well. We see huge amounts of abuse, and we see threats of physical violence towards democratically elected people, and I think we've got to a point where we have to address it. But I think we all have to address it, Nick. We have to address it as parliamentarians, as elected officials, and look at how we behave and what we do. But also the media has got a responsibility to think about how they cover politics. And social media obviously is another factor, because people are angry and people are passionate about issues. But there is absolutely no place in our democracy and in our politics for violence and for threats, the likes of which appear to have happened this week. It's not an easy job being a politician. It's a privilege and it's an honour, and we have to work incredibly hard, as we quite rightly should do. But we need good people in politics, and my concern is if we have this very toxic landscape and we have the threats and the fear of violence, we are going to lose good people from politics, and we're going to stop good people wanting to enter politics. So I think let's have robust, passionate debates. Let's disagree, but let's do it respectfully and in a civilised manner, and let's keep violence and violent behaviour and language out of our politics.
All right, and Kim, lastly, wishing you nothing but a long life and fine health. Would you ever go
Likewise,
for
Nick.
Yeah, but would you ever go for Sister Dyke?
The honest answer is I really don't know. And I haven't come to this issue because of my personal view as to what I would or wouldn't want. I think I would want the choice, but I also think it's impossible to say. I mean, you can only imagine what it's like to have a terminal diagnosis. And I spent time with people who are terminally ill, and you can't imagine what that feels like. But what they say is whether they would choose to use it or not. And a lot of people who sign up for assisted dying don't ever use it, but they describe the comfort and the reassurance that it provides in those final few months. So I don't know what I would do, but I firmly believe we should give terminally ill people that choice.
Thanks for your extended time today, Kim. Good luck to you. Great, enjoyed our time together. Kim Leadbeater is the Labour MP for Spen Valley, who is, of course, championing pushing through the assisted dying legislation. We've got to 9:35. Let's get some LBC headlines and Amelia Cox.
The Chancellor says growth in the UK economy at the start of the year proves the government's choices are beginning to pay off. GDP rose by 0.7% in the first 3 months of the year, slightly ahead of expectations.